it is called as a if-then logic. Okay. The second is approach is a data-driven, means the artificial intelligence is created by learning from the data, means machine learning. So now you allow your computer to learn from your data. So you give them few books, it will automatically learn from them. It's learn the pattern, and it's learn from the large database that is already given and provided to it. The issue with the data-driven AI using machine learning is a black box theory. Black box means exactly how the computer actually made decision about something. You don't know. If-then logic, you know that red means stop, go, green means go. Okay. So here is simple logic. If-then logic, it's defined with some data and the repetitive tasks. So you know now that how it's happened. But in the machine learning, you don't know, because how the data get calculated and how the decisions are made. So now, when we talk about India, we always talk about scalability of the technology. When we talk about India, we talk about the population, we talk about the disease burden, we talk about the medical professional available for the population. So why we looking for AI technology to help India, particularly the healthcare system? So our focus to use and bridge the gap which is in front of you, low doctor-patient ratio. So we need a rapid scan of the population to identify the disease or any disability. Rural disparity, as we go along with the deeper side of our India, we see the hospital and healthcare services are disappearing. It is even it's not reachable for the many of the population. And on top of that, disease burden. So right now, India is struggling with the dual disease burden. This dual disease burden means we are in a trajectory of facing two dual disease burdens. First is our infectious disease, which is tuberculosis, malaria, etc. So when you go in a rural side, you will see most of the time in the tuberculosis, malaria, filaria, which is called as an infectious disease. But as you go in the town or city level, you will see more of non-communicable disease. So India as a developing country facing the dual burden of disease. And AI actually can help to speed up the diagnostics, speed up the decision, and speed up the treatment through the AI technology. Machine learning foundation. So as we know that machine learning is the fundamental of artificial intelligence. You don't need to go technically in a more depth, but what you need to understand that the machine learning, it's the ability of the computer system to learn from the data set, whether it's a structured data or a unstructured data. The question to the audience What do you think? What sort of data that we can feed into the machine learning system that we get clear-cut output from the AI for our day-to-day hospital and healthcare service? Anyone from audience? What sort of data that we can actually give to the machine learning to learn from it and give us maximum output?
So radiologist,
Yeah, but from radiology, what we can feed into the machine learning?
sir, X-ray interpretations,
Sorry,
sir, X-ray के interpretations वगैरह.
X-ray. Okay. Anyone else from the other domain, physiotherapist or any other background? What sort of data that we can give to the machine learning that we can get result out of it rather than with just AI is there and nobody knows what exactly is helping us. Okay, now when you talk about the artificial intelligence application in hospital and healthcare, make sure what data behind the scene. Okay, so make sure what sort of data it's actually using to make decisions. So whenever you're evaluating any AI technology for your hospital, for your clinic, for your healthcare manager post, make sure where the computer is learning the model from what sort of the data. So machine learning process is a very complex, it's multidisciplinary, it's requires huge resources, huge investment, huge computing devices, and huge human resources to get something learned from the huge data set. Okay, so here is the characteristics listed of the machine learning. So all machine learning happen from the data. So it's data intensive. If you don't have a data, don't start machine learning. Adaptable. If you need more data, more quality data, more quantity of the data, it starts adapting, learning more and more. And the third is the pattern detection. This is very important. In machine learning, one technology called as a computer vision. So it's feed the live video or maybe live image of the any disease condition. It allow the computer vision is the type of machine learning allow computer to learn the image pixel by pixel. So each pixel getting fed into the machine learning and how that the computer learn, which is even with the human, because human can't evaluate pixel by pixel. It generalizes the image, but it can't learn out of pixel by pixel. So even a single, so how, so you might be wonder why computer system or AI system actually detecting the cancer. So when you put the digital pathology slide, AI technology actually evaluating the cell and the tissue sample pixel by pixel. And whenever it notices that any few characteristic getting changed from the normal pattern, and it's detected as a cancer. So that's how the AI is working for us, because it has a full-fledged computation power to analyze pixel by pixel of those digital pathology slides for the cancer detection. So we have to tell the computer what to learn, how to learn. It doesn't automatically decide. So when human intelligence is required to decide what sort of learning system that you are actually planning. So now, in general, we have a three type of learning system. The first is supervised learning. Supervised learning is very hard to understand technically, but let me give you an example. So in supervised learning, you need a doctor to tell what is it. So doctor is a supervisor telling the computer that this is 1 or this is 2. Is this red or is this green? Okay. So someone is a person or is an expert need to tell the computer what is it. That is called as a supervised learning. Okay. So if there is a chest X-ray, it's got some abnormality. So doctor will tell the computer, okay, this is pneumonia. So this is called as a label data, and it is supervised learning. In unsupervised learning, we don't tell machine learning system to recognize what is it. It learns without supervision. And the most important, it's digital pathology. So if we give the tissue slide digitally created to the AI system, so it has to learn automatically, because human can't see at pixel level, at the cell level, but computer can. So now you are not supervising anything, how actually computer is learning. So that is called as unsupervised learning. And reinforcement learning. So in reinforcement learning, you have two options, whether you actually accept right or wrong. So now in each attempt, the computer and the machine learning technology asking for your feedback. Did I perform good or bad? So either you reward it or either you punish it. So that is called as a reinforcement learning. Any question? Because this is important you to learn. This is very important for you to learn this three basic type of machine learning system. Any questions about it?
So can you explain again the reinforcement learning and with example?
Yeah. So in the reinforcement learning, so let me give you an example. You are teaching mathematics to your child. Okay. Now, child will perform the calculation. Okay, like addition or subtraction. So he or she will start with the trial. Okay. Or maybe on the first attempt, he is solving the mathematical calculation. Then you will reward him, isn't it? But you notice that he is doing well up to third step, but in the fourth step, he's doing the mistake. So you punish him. So in the next time on the third step, he is doing right, but he is now struggling with the fourth step. Then once again you punish until you get the ultimate answer. You punish him and get the ultimate result to get him a reward. Okay, so that is how you are reinforcing him to learn and minimizing the mistake as we go along with the learning. That's reinforcement learning.
Okay, sir, got it.
Common clinical algorithm. So as you are a doctor, as you are a hospital administrator, manager, executives, you are not working with the other data. You are working with the clinical data. So from the algorithm, you need to understand what algorithm work for which healthcare application. So in the any government facility, okay, you go in the emergency department. Doctor and nurses will take time to triage you. Triaging means whether you are a serious patient, you are a moderate patient, or you have just kind of fever and a headache. You just take paracetamol and go home. Okay, so that is called as an emergency triaging. Any government facility, there is 1,000 patients waiting to get triaged to see the doctor. So where we can use the algorithm called as a decision tree. Patient put key in her or his problem. I have a headache, I have a vomiting, I have had this issue, and I am taking this medicine. So the algorithm that works to make some central logic, it is called as a decision tree algorithm. So decision tree is a generic machine learning algorithm, but we use this to make quick clinical decision from the patient symptoms. The another algorithm you should remember, so this is very important you to understand and have a clear-cut healthcare applications in your day-to-day hospital job. So in the logistic regression, it decides the probability of something. So let's see, your hospital has dispatched the ambulance in patient's home. And now, nobody has decided whether patient should come to the hospital or patient should be treated in his home. So when someone puts all the signs, symptoms, patient vital, the logistic regression algorithm can decide this patient has a high probability to get patient into the hospital. The another very complex algorithm is support vector machine. So this very complex algorithm work on the MRI of the brain tissues. So if you would like to identify any tumor, any blood vessels burst in your brain, or any anomaly in the brain, you don't know. But when you give this MRI picture to the algorithm called as a support vector machine. It's classify the brain tissue whether it's a normal or a is abnormal. Another algorithm, deep learning, the neural nets, it interprets the image. But to able to get a deep learning work for this is a huge task. You need a huge data set. You need a huge computing power to get tuberculosis and the pneumonia diagnosed through the deep learning algorithm. Has anybody in the audience heard about the Cure AI? Cure AI is a very successful company, Indian company, I mean, uh, now recognized worldwide for their chest X-ray algorithm. They use roughly 1 crore chest X-ray from India. 1 crore plus chest X-ray, and then they have come up with the algorithm, come up with a model to detect the tuberculosis. Even this is also used by the NHS England in the somewhere in the America, Gulf countries. It's a very popular algorithm for the chest X-ray to detect tuberculosis lesion. And here's that you can see this chest X-ray getting processed in the Cure AI system. Okay, so Unit 11, we will see robotics and automation in healthcare delivery. Why we need robotics and automation? It provides us precision, safety, and logistic flow. Let's take 5 minutes comfort break and we will resume at sharp 17:50. Thank you all. Yeah, hello everyone once again. Let's resume our class and now let's see. Yes, I can see Rakesh. Yeah, any question? Or yeah, just giving me go ahead. Okay, in Unit 11, we will review the robotics and automation in healthcare delivery. So here, that it's very emerging area. It's a new technology. Lots of paradigm shifts happening in Australia, particularly very advanced country in Nordic region like Norway, Denmark, and so on. Even in Italy. Uh, what we're looking at, it's robotics and automation in healthcare delivery. So invariably, we have used lots of automation, but not robotics. Why robotics comes into the picture that we have now have a mature and stabilized robotics technology work for us safely in the clinical area and for the work. Okay. Yesterday, if you remember that a doctor from China performed the surgery in Hyderabad. So that's the marvel we achieved in the robotics technology. That the precision we have achieved so far through the robotics, that even the surgeon can perform the surgery on the patient from literally from anywhere in the world. What impact that we do see of robotics in hospital and healthcare? So the most important one, we need to understand the overall application layer of robotics. It's not just a straightforward that what many people think. So first of all, it is programmed robotics, that you understand that it's actually reducing the human error. So let me give you an example. In the very advanced hospital in US and UK, they are using robots called as a pharmacy robotics. So when you feed your prescription into the pharmacy robotics, it automatically collects the number of tablets, the strength of the tablet get collected automatically from the huge pharmacy store and packed for the patient. So that actually humans still can do the error, but not the robots. So that's a very good example of that you can reduce the errors of the pharmacist working in your pharmacy. So another aspect of the impact that what we do see in hospital, it's operational consistency because it's run by electricity. So that's why it can work 24/7. It's also address the workforce shortage. If you don't have a pharmacist, let's say in the rural area, we can deploy the robotics pharmacy. And what we have achieved, it is called as a surgical precision through the robots. The most complex vascular surgery nowadays getting performed by the advanced vascular robots, where it's even millimeter level precision is required, sub-millimeter, I should say, for the advanced procedure. Let's see if they would like to correct the blood flow in our arteries through the robotics precision, means the end-to-end anastomosis. The only robot can perform that precision. So now we are talking about The RAS means robotics assisted surgery. What is the benefit? It's a 3D high definition vision. So when we talk about, the surgeon perform surgery from China to Hyderabad, it's what he has got in China. He has got full visualization, 3-dimension visualization of the patient's abdomen or a chest. So directly he can view what exactly part that he needs to operate it on. The second is dexterity, means you have a full precision and or instrument movement. So when you move in needle, it automatically reflects in your 3D visualization that actually the needle is passing through the bone or passing through the tissue or passing through the muscles. And the most important use of surgical robotics in the 3 main area, I have seen lots of use case in urology. Urology, lots of complex procedure can be done through the robots because it can be inserted or through the urethra to the even up to the kidney to remove even small 1 millimeter stone from the pelvis of the kidney. Orthopedics and gynecology is an emerging craze, but now China and Korea, South Korea has a full-fledged body level robotic assisted surgery happening in their country. And this is a very good skill set. It's my advice that people who are coming from the technical background, tech interest, to learn how robotic surgery is evolving in India. And there are a huge job opportunity in hospital and healthcare area where you can take the leadership role in the robotics operation theater, robotics implementation, or a robotics business case. So this is one more example from the nursing and social assistance. In many advanced countries where lots of older people getting older and older, they required social and nursing support, and which is they have designed the robots for it. This is autonomous disinfection. So go into the patient's room and automatically disinfect the whole room. So it felt with the ultraviolet light, it felt with the required chemical, required gauge, and it automatically go into the patient room and it disinfects each corner and each area of the whole patient room. And that similar robots can work in the operation theater, in critical care, and so on. So why we need to robotize it? It's because the UV light is harmful for the human. It's deadly for the bacteria and virus, but it's harmful for the human. So we can automate this process. So it has a remote control outside the room. You send this robot inside the patient room, and you get outside of the room, and you just press the button in remote, and it automatically start working for you. And once it's complete the task, it automatically switch off. So you don't expose to the ultraviolet lights. One of the in my hospital and healthcare experience, one of the most important or most administrative bottlenecks which I come across, it's logistics and internal transport. Would anybody like to share their experience? What sort of struggle they have seen in their day-to-day hospital life in three aspects: material, pharmacy, and inventory? Anybody from the audience? I would like to explore your understanding why we need robots. Why can't human work? Anybody from the audience? Have they come across any issue with the material transport, pharmacy, or inventory control? Yes, Priyanka or Pooja or Femi Thomas. Anybody else? Yeah,
Sir,
any
there is
example.
an issue with the transportation medicine from pharmacy to nursing station.
Okay, anything else?
So there is a delay in transporting blood samples from the like ward or from ICU to laboratories due to
Due to lack of
human
what?
due to lack of workforce in hospital.
Okay, good example.
So pharmacy didn't provide the whole pack of the medicine. They provide in the small from cut pieces, like one and two medicines. So it's very difficult to understand that medicine is of which purpose.
Okay.
Sir,
Anyone else?
in case of inventory control, people have to keep a regular check about their expiry dates and all, about the buffer stocks. But with the help of AI system or the various applications, the problem gets solved within minutes.
Yeah, good. Yeah, Pooja, excellent observation. In a inventory control, let's inventory control now that you directed me with a very good subject. So in control, what's the problem? I have noticed even you all are working in the hospital or maybe going to work soon. The inventory is a major headache. Nobody knows percentage of stock getting expired in next month. Okay, let's start with the simplest question. Okay, so when you go to ask the managers, okay, what percentage of your drugs is getting expired in next month or maybe next quarter? But if you use the robotics, AI, machine learning together, it works for you. It automatically alerts 1 month prior of the batch which you have entered the expiry date with. It automatically alert you 1 month or 2 months, whatever you setting you would like to justify. It will alert you that this is the stock going to expire in next 3 months. So you can start utilizing it, or maybe you can return it to the your pharmacy store. Okay, number one, pharmacy automation. As you go along with the more and more complex drug, if it is like a paracetamol, ibuprofen, or anti-malaria drug, you don't need automation or you don't need robots. Okay, but I have seen the pharmacy which they told me that we have 8,000 medicine. I visited one hospital in London, and the pharmacy told me we have 8,000 medicine inside our pharmacy. and every day we process 400 prescriptions only within 4 hours. So they to process 100 prescriptions in 1 hour. So now one prescription only has even less than 1 minute, and where you need a pharmacy automation. Material transport. When you visit any foreign hospital or maybe advanced hospital, even in India, we do have logistic channels. Some they're using the vacuum, they are using the small lift, small lateral lift, etc. So when the robot and the technology can decide, so now let's say you would like to send 1 kilogram of parcel. Let's Pooja just mentioned about from blood bank to critical care, 1 blood unit. Okay, so we can actually connect critical care and blood bank with a special robots. So when you send the blood unit, it automatically goes into the critical care. So you don't need any human intervention in between. Good answer. And recovery. This is another application of machine learning, AI, and robotics that you can use in the physiotherapy, tracking, and the gamification of recovery. Now, this is very interesting. So, talked about the robots. Robots means the machine, okay? The electromechanical device which mimic our muscles movement. But now here we are talking about the robotics process or some automation. It's nothing to do with robots. Try to understand. RPA has nothing to do with robots. RPA is the automation of the software. Step and stage. Okay. So most of the time in your academic work, in your hospital life, you are using the mouse and keyboard, or maybe other visual and auditory information to process something for someone. Okay. In the RPA, robotic process automation, you can treat them as a digital worker for you. Okay. So let's see. You are a NABH auditor. Okay. You are a quality manager and you would like to perform the NABH audit every 3 months. So you can design the robotics process automation to perform audit for you automatically for all the data collected for the quality indicators. So you don't need to perform the spreadsheet, you don't need to perform the calculation, you don't need to analyze it, you don't have to interpret it, you don't have to prepare the slide for your CEO. It automatically complete all the steps which is you perform on your own, and that is called as a robotic process automation. Any question? Because this is a very interesting tool that you can start using. Even the lots of generative AI use a Claude, use ChatGPT to automate many of your functions to the robotic process automation. So this is the example from the revenue cycle management. The most common function in the hospital and healthcare industry, it is called as a revenue cycle management. And here let's see what sort of automation that we can deploy in the day-to-day work of RCM. So RCM has a defined stage: eligibility, coding, claims, and payment. And here's how we can get it automated. So most of the time, you'll see the medical record department is struggling with ICD-10 coding during the coding stage. But now through the AI, you can automate it. You just put the patient's diagnosis detail and you automatically create the ICD-10 code for it. And by automating this, you can save 30% of your effort and time.
So I didn't understand the previous slide.
You would like to go to the previous slide? Yeah. Any question in this slide? This is very important for all you to understand. Yeah. Who was asking the question?
So how does it work? I didn't understand it. At what level?
So so background. What are you? Pharmacy, physiotherapy? What's your background?
So I'm nursing officer.
Yeah, nursing officer. Okay. So in the coding, so you have a specialized software. Okay. So you put diagnosis. Let's be acute pneumonia. Okay. So it has a specific ICD-10 code for it. In the typical search, you have to actually search in the database, but in AI, it automatically creates your ICD-10 code for the coding stage of RCM. You can try it now. You can open Gemini, maybe Gemini. You can try the ChatGPT. You put act as a ICD-10 coder. I will give you the diagnosis and convert it to the ICD-10 code, and it automatically start responding with each diagnosis, and it provide you the ICD-10 code for each diagnosis.
So I understand this coding point, but I'm like unaware about the eligibility and payment and how it is connected to revenue cycle, and it is of what level, administration level, like how the revenue.
So there are special AI solutions available in the market. Okay. So when your company or your hospital deploys this automation of RCM, it takes care of all the states which is mentioned here: eligibility, coding, claim, and payment. It automates process. You don't have to do manually. You can define what stage can be done after completion of yes, partially, yes or no. Okay. So you can actually automate. You can do it in the new cloud software. You can do even in your spreadsheet. You can automate it.
Okay, so got it. I understand.
Yeah. So you have to explore those solutions. You go into the internet and search the automation, revenue cycle management AI applications and solutions, and you will see the lots of software available in the market. Data management and electronic health record. So you can put the AI layer and AI-powered robotic process automation in our day-to-day electronic health record. The most of the case, it's interoperability, documentation, and quality. So here, the Puja and the other doctors available here is the Raghav. Uh, Documentation is a very important use case of AI-powered RPA. So when you put the nursing diagnosis, when you put the medical diagnosis, it automatically guides you what to document or what not to document. Okay. So let me give you an example. If you put the diagnosis called as a wound, okay, in a leg, it automatically guide you. Like let me give you an example. Like let's say you put the diagnosis diabetic foot, okay. It automatically NLP means natural language processing automatically guide you as a nurse director what you should actually document. So it will guide you. Please enter the measurement of the wound. Please enter the exudate of the wound, etc. So you don't have to remember what I'm missing or what I actually entered. So now, once again, robotic assisted surgical system. So we have a kind of Indian landscape visible here. By the end of the 2025, usually we have had lots of ongoing robotics deployment, but the rough number is 150 plus. So in the big medical teaching institute, always they have a one robotics called as a Da Vinci, which is the most popular across the world. So you need to remember this word, Da Vinci robotic system. This is the most popular robotic system in the world. So here the example Da Vinci. So this is the typical Da Vinci system. You will see the lots of surgical probe enter into the patient's body, and nurse is adjusting the probe into the patient's abdomen, and you see in the just behind the scene you will see the one lady surgeon is operating from the console. It is called as a surgical console. This is one of the example of the emerging technology that many states are using the drone technology to deliver the medicine and the vaccine. Has anybody actually seen the drone in action?
No,
I've
sir.
seen in Jaipur. Yeah, in the Jaipur, whenever you go to Jaipur, it's one of the university I used to be professor. It's called as a Mahatma Gandhi University of Medical Science and Technology. They are collecting the blood sample. They are collecting and delivering blood collection and the tissue sample even from the 5 kilometer range in Jaipur. So drug, blood sample, it's a use case. So the drone, it's called as a 5x5, means 5 kilogram load and 5 kilometer range, which is very popular in Australia. I have seen the use case in Australia, Denmark, and in India. But now it's getting popular in congested city like the Mumbai and Delhi. It's a very quick, efficient delivery system to the drone. That's also example of smart telerobots. So now, what's the AI application in real world scenario. We talk about the AI technology, we talk about the AI, we talk about the different tools, but how to apply and deploy the AI technology. One of the most important and very straightforward AI use case in hospital and healthcare is a chatbot. So most of the hospital now has an embedded chatbot because it's available 24/7. It can guide you to check your symptoms, and also it has a power of multilingual support. And it's getting popularized in many Indian hospitals. But what I do see is lots of issues with the Indian language problem. Most of the AI tools I noticed is struggling for the multilingual support. Now, one of the practical example of chatbot in Indian hospital is the Practo and the Apollo Hospital. Disease screening and diagnostic, this is also excellent application, real world application of AI technology. The most of the time AI is helping us in detection of the cancer. Possible earliest cancer detection is only happening through the AI. And this is very good achievement of the AI technology that even before symptoms appear, even any tissue or a cell division is visible to even to the Microsoft. The AI technology can catch the possible earliest signal from the digital pathology system. This is very straightforward use case. Whenever you have any image, AI can work on it. That's simplest possible. You have an MRI, AI can help. You have a CT scan, AI can help. But it's take lots of resources, lots of intelligence to put AI into the practice for the doctors. But this is the most consistent and most usable technology case for the hospital and healthcare industry. From the Indian point of view, we have two major success stories in the AI application. The first is Cure AI. I would like you to see, and even you can arrange a demo for yourself in Cure AI. They set the global standard for tuberculosis detection. And another success story is Miramai. It's a combination of thermal imaging and AI to detect breast cancer. Many of you are working in the clinical trials. So AI technology and AI solution can help you to recruit the patient, monitor the patient, and analyze the patient's clinical level data. It's actually speeding up everything. So now it used to be taking 20 years to develop one drug molecule. Now it's reduced to 5 to 7 years. It's only due to the achievement in AI technologies. I just mentioned discovery got speed up due to the AI technology. It's reduced from 20 years to 7 years nowadays. Optimizing patient flow. This is very good use case for you all to learn. I'm not sure how Indian hospital actually utilizing the AI technology or AI process or maybe other tools to actually optimizing the patient flow. But I do see lots of hospital. I come across the example from Narayan Hospital in Narayan Rudralaya Hospital in Bangalore. They are using the automation and AI technology to speed up their discharge processes. So what India is doing? So we have a national level AI strategy. It address opportunity, AI for all, and AI garage. But as I mentioned earlier, that we have a policy level document for hospital and healthcare for AI. National Health Authority of India, they are also considering a few use cases of AI in the PMJY scheme for the patient. The most important use case in the global that we all know what happened in the COVID era. That time we didn't actually use precisely AI technology, but we have had a few use case of the machine learning that we can actually started detecting the possible earliest geographical area that where we see the most of the cases of the COVID is coming from. So this is economic case of healthcare AI. So India actually participating and taking more risk to adopt the AI. So we have had a very good growth in last couple of years, but by 2030 we'll see roughly 40% plus CAGR of the AI technology working in the hospital and healthcare. So the question for audience. Well, let's see if you are a hospital and healthcare manager. What do you think? Are you ready to adopt? Are you considering the AI technology for the hospital or not? Anyone from the audience? Because you see the 2032, we have a $17 billion market. But are you ready to take this call or not? Anybody from the audience?
So there is something which I want to add.
Yeah, Dr. Rathod, please.
Sir, as we know that before this AI era, machines are better than us. Then machines are not better than us because we have the ability to think and we have to express our things. We can think better from the machines. But after the AI, is we are ready for that for this thing? Because the AI think are making decisions all this about decisions and decision making and calculations.
Yeah, so Dr. Raghav and Pooja, as you are from the doctor and nursing side of the hospital, when you adopting the AI, okay, let's see next couple of years, hmm, are you considering that the workforce we are preparing, nurse workforce, doctor workforce, actually they are getting replaced by the AI itself. So they are not confident. They are not kind of, challenging the AI. They themselves actually put themselves in a side. Oh, let AI to work. I don't want to interpret this X-ray. So one of my friends, when I introduced Cure AI in one of the NHS England hospital when I used to work there, he just simply told me, Bipin, it's your passion that you would like to put the Cure AI in the hospital. It is my passion as a physician to put the AI into the hospital. But the doctors who are learning, they are pursuing MD and MBBS. They would like to see the X-ray and they would like to make interpretation, and which you are not allowing them to do. You already putting the diagnosis even before they decide something. So the issue with the exam force is going to be get redesigned. Okay, we can't now teach X-ray to the doctor because it's going to get replaced by the AI. Then why we even teaching the X-ray interpretation? Are you with me? So healthcare and hospital workforce is getting redefined and redesigned due to the upcoming evolution in the AI technologies. Even we won't need a pathologist because AI technology interpreting all the cancer slide. Before even they able to see it, AI technology actually detects the cancer. But that's the reason we need to make sure that whatever we do sensibly. But as you know, the AI technology is not cheap. We need to invest. You need to make sure as a healthcare and hospital manager, while you are implementing the AI technology, you make close call to your chief finance officer. Okay, this is our investment and this is what we get from the investment. So always check with the AI technology company that what sort of return on investment that we can expect from this technology. As you are a healthcare professional, you already know what is ethics, privacy, and security, but you need to make sure that you understand in the context of the AI and technology. Bias and equity always be there. Whenever you're working in the hospital and healthcare area, you always come up with this question whether my solution is equitably distributed and is not biased from any data collected over the period of time. Accountability and liability. This is one of the big questions always asked by the decision makers, by surgeon, by manufacturer, and by the hospitals. Who are accountable and who are liable if something goes wrong in AI technology. To achieve Viksit Bharat 2047, AI is the pillar. And we have set the mission to able to use AI technology and emerging AI technology in 2024 to democratize the technology for humanity, and we should have a unified strategy to put AI technology for the specialist shortage. So as we go along with the achievement of the Viksit Bharat, we need to make sure that we have a targeted AI use case and mission that we can achieve the Viksit Bharat by 2047. To summarize, what's the road ahead? Make sure you understand innovation, you understand responsibility, and you understand the vision why we need AI and equitable healthcare for all through the emerging technologies. So we have completed this session, and I'm ready to take any questions from anyone in the audience. Thank you very much. Over to audience, any question, any concern? Anyone from the audience?
So is there any job opportunities in healthcare management from where we deal with these robotics and AI things?
Yeah, anyone else? Any other question? I see Dr. Srishti Gupta joined. Then, yes, Dr. Raghu. Lots of limitations are there, but what the technology and the company are evolving with high speed. They are very proactive. So they know the limitation before even they start, but they are actually have a multidisciplinary developer. So they know before even developing the technology, they know the limitation. But the limitation is the human touch. That's what I noticed many times. That even that let's see, even the AI technology there is a make diagnosis. It's given the prescription, but the human touch. You need to explain the family. Okay, so if a patient is dying, okay, AI can't explain the patient relative why patient is dying and what sort of emotional support they might require from you. So, the emotional intelligence is never been achieved by the AI technology. And that's what we have a concept called as a human in the loop. So whenever we working on the technology side of it, we always put the human in the loop, where we need human while we are using AI technology. Raghav asked if an AI, okay, 1 minute. If AI system gives a wrong diagnosis, you should be responsible. Yeah, so Dr. Raghav, now we have a clear-cut AI policy in hospital and healthcare. So there is a clear-cut mention about responsibility matrix, accountability, responsibility matrix given in the decision-making process. So if you are working in a particular organization using the ABCXYZ AI technology, you need to come up with a clear-cut policy guideline uh, that define who is responsible if something goes wrong for the patient and for the surgeon or for the any physician. A document available in public, AI policy in hospital and healthcare. It is hosted in the government website. There is a clear-cut responsibility matrix given there while you are using the AI technology for diagnosis and treatment. Any inputs from anyone? What they think about the emerging technology? How they should drive it in their hospital? What better approach can be taken? And anything. It doesn't have to be very academic, but what's the practical aspect of it? What is the typical Indian case that you would like to see? Because the India is India, so you have to think about India. Whatever is available, it doesn't make sense sometimes in the primary or secondary care of Indian healthcare system. So all of the students, we are now approaching the end of this session. So I think we better close this session now, as we are now run out of the question from the audience. Thank you, everyone, and I hope that you learn the AI and robotics aspect of the hospital and healthcare delivery. Yes, Dr. Raghav put into the chart that AI can influence or change the decision-making perspective that can or maybe dangerous. Yes, so any Any technology or any innovation is always carry the risk and always carry the danger. What we need to make sure that it has a multidisciplinary review. It is reviewed in a more critical scenarios. It gets benefit to the patient, to the healthcare professional. That's what how we adopt the technology. The, one of the influence I do see it's our learning behavior. Many of the students now, it's habitual to ask everything to ChatGPT. And this is actually dangerous because we have a quick learning curve, but it's heavily technology dependent. You don't want to read for what exactly is written in the textbook. You just need an answer. But you now don't care about what is science behind it. And that's getting into the dangerous situation. Thank you all. And I will see you tomorrow at 5 p.m.